All right, welcome back, coding students. Let's jump right into today's explainer, which is all about the absolute foundation of what we do as medical coders. We're pulling this straight from part 12 of the course. Today, we're talking about how to translate the physical, messy reality of the human body into standardized, billable coding language. Because honestly, before you can master the codes themselves, you really have to master the canvas those codes describe. And that means getting a solid grip on anatomy, how different injuries actually work, and the terminology doctors use to document the whole shebang.
Here is a quick look at our roadmap for today. We'll cover anatomy and disease processes, illness versus disease, acute and chronic injuries, deciphering medical terminology, and finally, putting words together.
Okay, let's kick things off with Section 1, Anatomy and Disease Processes.
So most coding programs out there are going to approach the body by teaching you from the outside in, and that starts right here with gross anatomy. Simply put, this is the study of the structure of the human body, specifically focusing on the parts that are externally visible. Getting totally comfortable with how the body is built at this macro level is literally step one for any medical biller or coder.
Moving a bit deeper, those visible parts organize themselves internally into systems. Take the circulatory system, for example. A body system is just a collection of organs working together to carry out a specific function. It's like a giant puzzle where every piece matters. Just like the brain and spinal cord team up to make the nervous system, your heart, lungs, and blood vessels cooperate to circulate blood. As a coder, your very first move when looking at a procedure is figuring out the relevant body system code from the CPT. You've got to know the neighborhood before you can find the house, right? But what happens when that system goes off the rails and isn't working properly? Well, that brings us to the disease process. This is basically a variation from the normal structure or function of a body part, and it always shows up in the form of symptoms. The thing is, a disease process is never just an isolated event. It ripples through the entire body system. So you really must understand how this process connects to the actual procedures being billed. The diagnostic code you end up assigning represents this specific disease or damage, and that is exactly what proves the medical necessity for the treatment.
All right, moving on to Section 2, illness versus disease.
You know, it's kind of fascinating how we all use the terms illness and disease interchangeably in everyday conversation. But in the coding world, they are absolutely not the same thing. An illness is a state of mind or body. A patient can have an illness, like type 2 diabetes, but they might not actually feel sick or show any evident external indications at all. A disease, on the flip side, actively interferes with normal body operations and manifests with observable physical symptoms that you can actually see or measure.
So why does this distinction actually matter for your daily job? It comes down to evaluation and management, or E&M visits. When a doctor bills for an E&M visit, they are legally required to document the presence of at least one sickness or disease-related phrase in that patient's file. Even if the patient literally just came in for a common cold, you have to find and code that documented condition to justify the consultation. It's the golden rule here.
Next up is Section 3, Acute and Chronic Injuries.
As a coder, you have to be highly aware of the difference between an acute and a chronic injury. The pathways are totally different. An acute injury is accidental, recent damage where the affected tissue is still viable, meaning it can survive. But a chronic injury? That develops over time from continued use, aging, or a wound that just never fully healed. Chronic injuries are incredibly important to spot because they almost always demand much more complex surgical effort. The body's attempt to repair itself over a long period usually forms scar tissue, which we call fibrosis. So treating a chronic injury might actually require removing that non-viable tissue entirely or even doing tissue transplants.
But let's be real for a second. Patients are often completely oblivious to how or when their condition actually started. So, what do? How do you choose the right injury code if the backstory is totally murky? Well, you kind of have to become an investigator.
Here is your exact game plan for playing detective. Step 1. Inspect the medical history for the date the patient first sought care at the facility. Step 2. Dig into the patient info page for a specific date of injury. Step 3, and this is a massive pro tip, look for context clues in the report. If you spot a word like pathological, that is a huge hint pointing to a long-term disease process, meaning chronic harm, not an acute one. And finally, if the clinician gives you absolutely no instructions and you are totally in the dark, you default to the chronic injury-related codes. Do not just automatically assume an injury is acute just because the patient walked in after a recent event.
All right, Section 4, Deciphering Medical Terminology.
Think of this part as your ultimate cheat sheet.
Almost all that intimidating medical jargon is really just a combination of a prefix and a suffix rooted in Greek or Latin. The prefix, which is the beginning of the word, usually tells you the location of the issue inside the body. For example, arthra means joint, and nephra means kidney. The suffix, the end of the word, describes the actual condition or the action being taken. So scopy means using an instrument to see, and itis means inflammation.
Let's bring it home with Section 5, putting words together.
Let's put this theory into practice, shall we? First up, chondromalacia. We just break it right in half. We have the prefix chondro, which alludes to cartilage. Then we have the suffix malacia, which indicates a softening. You snap them together, and chondromalacia literally translates to softening of the cartilage. See how perfectly that works? It's like building blocks.
How about a super common one, arthritis? We take artho, our root for joint, and snap it together with itis, our suffix for inflammation. Boom! Arthritis simply means inflammation of the joint.
Next, we've got osteopenia. The prefix osteo refers to bone. The suffix penia indicates a lack or deficiency. So the second you see osteopenia in a chart, you instantly know the condition is a loss of bone. No dictionary needed.
All right, let's look at nephritis, connecting back to that cheat sheet from earlier. Nephro tells you we're dealing with the kidneys. Itis tells you there's inflammation. Put it together. Nephritis is inflammation of the kidneys. As a coder, you now know exactly which body system you are dealing with just by reading the word.
And we'll wrap up this rapid-fire round with myalgia. My refers to muscle, and algia indicates pain. Therefore, myalgia translates directly to pain in the muscles. Seriously, if you can just learn these core word pieces, it's a total game changer. You won't need to memorize a medical dictionary. You can deduce the meaning of almost any procedure or diagnosis in a chart, completely transforming how efficiently you code.
By mastering anatomy, recognizing the nuances between diseases and injuries, and decoding the foundational language of medicine, you are well on your way to becoming an expert medical coder. So, the next time you're staring down a massive, complex medical chart, take a breath and ask yourself, what story are these Greek and Latin roots actually trying to tell me? Thank you so much for joining me for this explainer. Please like, share, and subscribe to Decode Healthcare with Harshal.